Hi everybody and welcome to AARC's Big Ideas Theater. I'm your host, Ed Hyland. Joining me now is Katrina, the speaker of an upcoming session today on indications for cardiopulmonary exercise training. Katrina, thank you so much for coming by and joining us today.
You're welcome. It's a pleasure to be here.
Let's just talk a little bit about what you're going to be discussing this afternoon. Why would you perform a cardiopulmonary exercise test in a patient with lung disease?
It's a very good question. Cardiopulmonary exercise testing is a very dynamic and complex procedure. We have lots of tools within the procedure to evaluate ventilation, hemodynamics, all those types of things. So for a patient with lung function, we can look at what's their maximum oxygen consumption, correlate that to whether or not they could be a candidate for surgery. We can also look at the flow volume loop kinetics, kind of the dynamics of that curve to see how limited they are in their breathing. It just kind of helps quantify what that limitation is and maybe help them adjust with their everyday activities, maybe give them a medication to help with some of the flow limitation, include an exercise prescription to get them more active, those types of things. So it has multiple uses in that case.
Give us an idea of the role of the respiratory therapist in conducting the test.
The role of the therapist is critical. They're responsible for keeping that patient safe, keeping that test going. Once the test starts going, you need to keep it going and you can't let it stop. But also being a really strong coach. When you're working to a maximum exercise level, your first thought is, this is really hard and I just want to stop. And so it's the therapist's job to give words of encouragement, remind them that everything looks great, your oxygen is good, your cardiac image looks great, you're going to get to that next workload, keep pushing, keep pushing, keep pushing, don't stop, so that we can get them to that maximum levels that we're looking for, so that when we interpret that data, it's accurate and we can give a clinical interpretation that's valuable.
What are some of the drivers, if you will, behind the testing that would be involved?
It depends on the indication. What's the clinical question? What are we looking for? If I have a patient that comes in with stridor, when they're doing extreme exercise, a new technology or new test that's being done is video laryngoscopy. And so what we do is we put a rhinoscope down the nose. It sits above the vocal cords, and we can look at the upper airway architecture to see whether or not it's causing the patient the distress, the ventilatory limitation, or sometimes they have a structural collapse. The arytenoids might collapse over that airway entirely. If the patient is desaturating while they're exercising, we can put an art line in to measure, how much oxygen do they have at rest and then throughout the progressive exercise stage to determine whether or not that might be their limiting factor. So it just depends on what's that clinical question as to what adjunct pieces we add.
And that kind of builds onto another thought I had about where do we go from here? In other words, you have a layer, you know what you need to do now, but what do we do in the future? How do we make it better, basically?
I think it's, right now what I see as one of the biggest struggles is understanding the right test for the right indication, and not just picking out a bunch of different tests out of a hat because I'm trying to just process of elimination. We really need to look at our patients' histories, know our protocols that are used, know the tools available with cardiopulmonary exercise testing, and be mindful of those that we're using. A lot of the tests within cardiopulmonary exercise testing are very expensive for patients. They have risk associated with them to our patients. And so you need to be educated enough about all of those aspects before you go and perform a stress test on a patient.
Katrina Hynes, thank you so much for the great information and sharing with us here at the Big
Welcome.
Ideas Theater.
Thank you.
And this is the Big Ideas Theater at AARC. I'm Ed Hyland. Thanks for joining us.